Here's why everyone is wrong about quad strengthening to help heal knee arthritis. See, there's tons of medical research showing that as quads get weaker over time, knee arthritis gets worse over time. And so this leads people to believe that if you get the quad strength up, that you'll be helping knee arthritis. But I completely disagree with that thought. Let me explain to you why. Here's what the graph looks like for most of these research studies. They will show you how strength, I'm just going to write STR, of quads will go down as knee arthritis gets worse. So I'm going to write knee arthritis down here, and it's usually mild at the beginning, then moderate, and then severe on the far end. And this usually correlates with age. So it usually starts around 60, then 70s, and then 80s and beyond. And what you'll see is quad strength tends to just decline as you get older and as knee arthritis gets more severe. And this is what the research studies tend to show. They show this correlation between quad strength going down and age going up, of course, and severeness of knee arthritis becoming more and more severe. But what research studies don't really take into account very much is all that happens before this. So let's extend this graph backwards in time to when people are younger. Let's go all the way this way, and we'll do strength still on this side, STR. And we'll put 50s in here, 40s, 30s, even down into your 20s. And this is what quad strength usually looks like in your younger years. You start out kind of high and it kind of starts to decline maybe around the 50s or so, and then knee arthritis sets in, and that's when it goes down way much. But what about glute strength? Because I talk about glute strength a lot. It's part of the imbalance that I think is causing knee arthritis. Here's what happens, and this isn't studied in the research very much. There is some research showing that glute strength could be connected to knee arthritis, but it's just not well researched, which doesn't mean that it doesn't exist. It just means we don't know yet. We haven't figured it all out. And same thing with the quads. We haven't figured this out either. But I think this is how it happens. Glute strength, we'll make it purple. It's up here, and then it starts to decline sooner than quad strength, and it kind of flatlines for a lot of people. We'll write glutes up here so that you know that this purple line is glute strength. I'm talking about the muscles in the back of the hip. And here's my theory on this. As you wrap up school, right, in your teens, you went through grade school, you got to 12th grade, maybe you did college in your early 20s, and maybe you even had a desk job where you sat a lot more. Kids come around and life just changes. You tend to sit more. Not everybody, but you tend to sit more. And when you're sitting on your glutes, you're putting your hips in a flex position, which lengthens your glutes on the backside, and it slowly weakens them over time. We know by research, and it's time tested, we know this, that a low level stretch for a long period of time, like when you're sitting, makes muscles weaker. So when glutes get weaker, you lose some of the stability in your leg, in your hip, and in your knee, and something has to compensate in order for you to be able to still walk and exercise and do the things, keep up with your kids, keep up with grandkids eventually. And so as a result, quads stay strong, maybe even get a little bit stronger in order to compensate for this weakness in glutes. And it's in this gap right here that you have an imbalance of muscle strength. We'll call that an imbalance. And that imbalance, let me show you on the skeleton here, because your quads here on the front are too strong. They connect to your kneecap and down to your shin bone. So if they're very strong, they're going to be pulling everything up. The shin bone's going to be going upwards here, and the kneecap's going to be pressed against the thigh bone, and that's going to compress the cartilage on the end of the thigh bone on the back of the kneecap. And over the course of decades here, it leads to increased compression, which means to cartilage not being happy. It gets hurt. It gets irritated. So you have this situation right here. Down here you have this situation. And over here you have that situation. So healthy cartilage up here because it's balanced, Then you have an imbalance, and cartilage can take quite a beating. It's usually years, sometimes even decades before you start to see damage on it. It's just a slow metabolic tissue, meaning that it's like moving in slow motion, the cells inside, and it can take quite a beating. It's designed to take forces, but it has its thresholds. Once you hit 50s, 60s is when it starts to show damage, and then but if that continues, that imbalance continues, then you have severe damage over here, and the bones also adapt. So how do we fix this? Because why are they wrong? What should we do instead? Well, here's what I think we should be up to. If we can redo these lines, and let's just start in your younger years. Oops, let's start with, this is your quads up here. They should stay strong ideally. I don't want you to have weak quads. I just want you to have balanced muscles. If you have that situation, then there is no discrepancy between the two muscle groups. And so the pressures in your knee joint are going to be normalized, and you should be able to maintain a healthy knee with healthy cartilage throughout your life into your older years. Now, what happens for a lot of people, though, is they do end up with that discrepancy. Let's redo these lines. These are people in our knee arthritis recovery program. They are dealing with those weak quads, the weak glutes that happen around here, and they go down like that. And then they have the quads that start to decline and go down that way. This is where the researchers are focusing, and they're seeing the knee arthritis get worse as the quads strength goes down, but they're not paying too much attention to the glutes. Well, we want people to do this. Get those glutes back up so that now this stays this way. The quads continue to stay strong, and your glutes are also strong. Now you're healthy in your 70s and 80s. I truly believe that healthcare professionals everywhere and people that are telling you to strengthen your quads are doing the best they can with what they know, but they're missing this understanding of what's happening with the glutes. And what people are told, especially people going through medical school, through physical therapy schools, they're told to follow the best available research evidence. But when we don't have great evidence on something, then we're doing the best we can with what we got. And if it's not the full picture, you might get some treatments that don't help you out. But if you're doing quad-based exercises and you have knee arthritis and you feel yourself getting worse, chances are you're in this situation where you have a muscle imbalance, and you probably need to focus on the glutes. There's other muscles too that I haven't even mentioned here, like foot muscles and abdominal muscles that we focus on. I tell people all about this in the knee arthritis recovery program. We walk them through all the steps to heal their knee arthritis. You can always learn more about it by going down in the description and checking out the link. But if you want to learn more about cartilage right now, then check out this video right here. It's called Heal Your Cartilage and Avoid a Knee Replacement. Cartilage can heal. It's a slow metabolic tissue, but you have to put it in the right healing environment by correcting the muscle imbalance. And this video will show you how to get started on that.